Rapid Review Part 2, First Aid Usmle Step 1, 2025, 35th edition. Next condition is what causes acute pancreatitis. Acute pancreatitis is caused by autodigestion of pancreas by pancreatic enzymes. Next, Rh hemolytic disease of the newborn. Rh negative mother forms antibodies, which is called maternal anti-DIgG against RBCs of Rh positive fetus. Rh hemolytic disease of newborn is caused by Rh negative mother forming antibodies, which are also called maternal anti-DIgG against RBCs of Rh positive fetus. Next condition, anemia in lead poisoning. Anemia in lead poisoning is because lead is metal. Lead inhibits pyrrochelatase and ALA dehydratase. Lead inhibits pyrrochelatase and ALA dehydratase. This causes decreased heme synthesis, which leads to increased RBC protoporphyrin. Anemia in lead poisoning is because lead inhibits pyrrochelatase and ALA dehydratase, and this causes decreased heme synthesis, eventually leading to increased RBC protoporphyrin. Next condition, what causes anemia of chronic disease? Anemia of chronic disease is basic mechanism is inflammation. This inflammation causes chronic inflammation. So chronic inflammation causes increased hepcidin. Increased hepcidin will cause decreased release of iron from macrophage, decreased iron absorption from gut. So that's why anemia of chronic disease. You have inflammation leading to increased hepcidin, leading to decreased release of iron from macrophages and decreased iron absorption from gut. What causes G6PD deficiency? G6PD deficiency. G6PD defect is caused by decrease in NADPH, which leads to reduced glutathione. So you have two decreases. You have reduced glutathione, which means there is increase in glutathione, increase RBC susceptibility to oxidant stress. This causes G6PD deficiency. Next condition is sickle cell anemia. Sickle cell anemia is caused by point mutation causing substitution of glutamic acid with valine in beta chain. This leads to low oxygen. High altitude acidosis participate, sickling, polymerization, deoxygenated HBS causes anemia. You also see vaso-occlusive disease in sickle cell. What causes Bernard-Solier syndrome? Bernard-Solier syndrome. Bernard-Solier syndrome is caused by decreased GP1B and decreased platelet to Wall-Willebrand factor adhesion. Next condition, Glanzmann thrombosthenia. Glanzmann thrombosthenia. Glanzmann thrombosthenia decreased GP2B/3A, leading to decreased platelet to platelet aggregation. Decreased platelet to platelet aggregation. This leads to defective platelet plug formation. Next condition is TTP, thrombotic thrombocytopenic purpura, caused by decreased ADAM13, decreased ADAMTS13, which is also called von Willebrand factor metalloprotease. This leads to decreased degradation of von Willebrand factor multimers, leading to increased platelet adhesion and aggregation. Eventually, you see microthrombi formation. So TTP, decrease ADAMTS13, von Willebrand factor metalloprotease, leading to decreased degradation of von Willebrand factor multimers, leading to increased platelet adhesion and aggregation. This is called microthrombi formation. Next, which is very high yield von Willebrand disease. This is caused by decreased von Willebrand factor. Decreased von Willebrand factor will cause decreased platelet to von Willebrand factor adhesion. possibly increased PTT. So increased PTT is from von Willebrand factor protects factor 8. So when there is no protection to factor 8 by von Willebrand factor, you see increased PTT. Next condition, factor 5 Leiden. Factor 5 Leiden is caused by mutation in ARG506 GLN, mutation in factor 5, causing resistance to degradation by protein C, and this leads to hypercoagulable state. Factor 5 Leiden ARG506 GLN mutation in factor 5 due to resistance to degradation by protein C. What causes HIT, heparin-induced thrombocytopenia? Heparin-induced thrombocytopenia is, there are two types of HIT type 1 and type 2. HIT type 1, heparin-induced thrombocytopenia, uh, you give heparin administration. However, within 2 days, patient starts to have mild transient drop in platelets, but otherwise he's stable. There is mild transient drop in platelets, but not clinically significant. However, HIT type 2 is significant. Heparin administration is done to the patient, and you see after 5 to 10 days, there are IgG antibodies against heparin-bound platelet factor 4 complex. This complex binds and activates platelet. This complex that binds and activates platelet leads to thrombosis, removal by splenic macrophages, which causes decreased platelet count, significant thrombocytopenia. The platelet drop is huge after day 5 or day 5 to 10. And reason behind is IgG antibodies against heparin bound platelet factor 4 complex. Next condition is warfarin induced skin tissue necrosis. Warfarin induced skin tissue necrosis is when warfarin is administered to the patient and you see rapid decrease in protein C levels due to shorter half-life, which causes procoagulant state due to delay in depletion of other existing clotting factors with longer half-lives. This leads to hypercoagulation and microthrombosis. This leads to skin tissue necrosis. So, skin tissue necrosis is the main reason behind warfarin-induced skin changes. Warfarin administration leads to rapid decrease in protein C levels due to shorter half-life of protein C. This leads to procoagulant state due to delay in depletion of other existing clotting factors with longer half-lives. This leads to hypercoagulation and microthrombosis, causing skin tissue necrosis. Next condition is axillary nerve injury. Axillary nerve injury caused by fractured surgical neck or anterior dislocation of humerus. Anterior dislocation of humerus. This leads to flattened deltoid arm at side and decreased shoulder sensation. Next condition is radial nerve injury. Radial nerve injury is also called Saturday night palsy in layman terms. This radial nerve injury is caused by axilla compression using of crutches, which compresses the axillary nerve in axilla region. This is also caused by mid-shaft humerus fracture, repetitive pronation, supination of forearm causes wrist drop, and there is decreased grip strength. Wrist drop and decreased grip strength, pathognomic of radial nerve injury. So once more, radial nerve injury is axilla compression by usage of crutches or mid-shaft humerus fracture, and repetitive pronation, supination of forearm will lead to wrist drop, decreased grip strength, and axillary nerve we discuss as axillary nerve injury we discussed before, fractured surgical neck or anterior dislocation of humerus, flattened deltoid arm at side, and there is decreased shoulder sensation. Next, high yield info median nerve injury, which is also called hand of benediction median nerve injury. Proximal lesion, supracondylar fracture leads to loss of wrist flexion and function of loaf muscles. So LOAF muscles. Proximal lesion, supracondylar fracture leading to loss of wrist flexion and function of loaf muscles. Loss of sensation over thenar eminence. There is also dorsal and palmar aspect of lateral 3.5 fingers. Distal lesion causes carpal tunnel syndrome. In median nerve injury, in distal lesion, you see carpal tunnel syndrome. Next condition, high yield ulnar nerve injury, is because of proximal lesion, proximal lesion and distal lesion. So, ulnar nerve injury has two parts. Proximal lesions, distal lesion. Proximal is fractured medial epicondyle, fractured medial epicondyle, fractured medial epicondyle. Proximal lesion leads to radial deviation of wrist on flexion. Distal lesion causes fractured hook of hamate, fractured hook of hamate. Distal lesion fall on outstretched hand, push, which is also ulnar claw on digital extension. Loss of sensation over ulnar digit. Loss of sensation over ulnar digit. So loss of sensation over ulnar digit. Once again, ulnar nerve injury, proximal lesion, distal lesion. Proximal lesion is caused by fractured medial epicondyle, fractured medial epicondyle, and you see radial deviation of wrist on flexion. Ulnar nerve injury, and if there is a distal lesion, you see fractured hook of hamate because of fall on outstretched hand, ulnar claw on digital extension. You also see loss of sensation over ulnar digits. Next is herb palsy. What is herb palsy? Waiter step. It's basically traction tear of C5C6 roots on infant's neck during delivery or due to trauma in adults. What is herb palsy? Waiter step. Traction tear of C5C6 roots on infant's neck during delivery or due to trauma in adults. Next condition is Klumpke's palsy, which is also called claw hand. Claw hand, Klumpke's palsy. Mechanism behind this injury is traction tear C8T1 root on infant's arm during delivery or on trying to grab a branch in adults. So traction or tear of C8T1 roots, traction of C8T1 roots on infant's arm during delivery or on trying to grab a branch in adults. When do you see winged scapula? Winged scapula is when you have injury to long thoracic nerve C5, C6, C7. Injury to long thoracic nerve C5, C6, C7 seen after mastectomy or stab wounds. Winged scapula, injury to long thoracic nerve C5, C6, C7 seen after mastectomy or stab wounds. Next condition is common peroneal nerve injury. Common peroneal nerve injury is caused by trauma to lateral leg. Trauma to lateral leg. Common peroneal nerve injury, trauma to lateral leg, or fibular neck fracture. You see foot drop with steppage gait. Foot drop with steppage gait. Foot drop with steppage gait. Next is superior gluteal nerve injury. Superior gluteal nerve injury. Mechanism behind superior gluteal nerve injury is iatrogenic injury during intramuscular injection in gluteal region, causing Trendelenburg sign, lesion contralateral to side of hip that drops due to abductor weakness. Intramuscular injection in gluteal region leading to Trendelenburg sign. This leads to lesion contralateral to side of hip that drops due to abductor weakness. Next is pudendal nerve injury. Injury during horseback riding or prolonged cycling can be blocked during delivery at the ischial spine. This leads to decreased sensation in peroneal and genital area. You can or you cannot see fecal urinary incontinence. So, pudendal nerve injury is caused by injury to uh, ischial spine. Ischial spine injury because of maybe horseback riding or prolonged cycling. This can be blocked during delivery at ischial spine as well. Decreased sensation in perineal and genital area may or may not see fecal urinary incontinence. Next, what causes radial head subluxation? Radial head subluxation also called nursemaid's elbow is due to sudden pull on arm. In children, radial head slips out of immature annular ligament. Sudden pull on arm. In children, radial head slips out of immature annular ligament. Next, what is slip capital femoral epiphysis? When you have obese young adolescent with hip knee pain, increased axial force on femoral head causes epiphysis displaces relative to the femoral neck. SCFE, slipped capital femoral epiphysis, which is caused by obese when there is obese young adolescent with hip or knee pain. On increased axial force on femoral head, you see epiphysis displaces relative to femoral neck. Next condition, achondroplasia. Achondroplasia, constitutive activation of FGFR3. FGFR3. Achondroplasia is constitutive activation of FGFR3. You see decreased chondrocyte proliferation, failure of endochondral ossification, eventually leading to short limbs. Next, osteoporosis. Osteoporosis is increased osteoclast activity, leading to decreased bone secondary to decreased estrogen levels, typically in old age, and long-term use of medication like steroids. Osteoporosis, increased osteoclast activity, decreased bone mass secondary to decreased estrogen levels, old age, and long-term use of medications like steroids. What causes osteopetrosis? Pet Pet dog, petrosis, petrosis. Osteopetrosis is carbonic anhydrase 2 mutation, causing decreased ability of osteoclasts to generate acidic environment. Decreased bone resorption. This leads to decrease to dense bone prone to fracture. You also see pancytopenia and decreased marrow space. Osteopetrosis, carbonic anhydrase 2 mutation, leading to decreased ability of osteoclasts to generate acidic environment. This causes decreased bone resorption. There is no resorption from the bone, so bone collects calcium and you have dense bone prone to fracture. You also see pancytopenia and decreased marrow space. What is osteoitis deformans Paget's disease of bone? High yield. Osteitis deformans Paget's disease of bone, increased osteoclast activity, followed by increased osteoblast activity, formation of poor quality, fracture prone bone. Formation of poor quality bone because of increased osteoclast activity, followed by increased osteoblast activity. What is the cause of osteoarthritis? Osteoarthritis, also high yield mechanical degeneration of articular cartilage, leads to inflammation with inadequate repair osteophyte formation. Mechanical degeneration of articular cartilage leading to inflammation of inadequate repair leads to osteophyte formation. What causes rheumatoid arthritis? Rheumatoid arthritis caused by autoimmune inflammation leads to pannus formation, erosion of articular cartilage and bone. Erosion of articular cartilage and bone. Next, Sjogren syndrome. What causes Sjogren syndrome? Sjogren syndrome is caused by autoimmune reaction when you see lymphocyte mediated damage of exocrine gland. Sjogren syndrome, autoimmune reaction, and you see lymphocyte mediated damage of exocrine glands. Next condition is SLE, systemic lupus erythematosus, predominantly type 3 hypersensitivity reaction with decreased clearance of immune complexes. Hematologic manifestations are type 2 hypersensitivity reaction. Hematologic manifestation, you see type 2 hypersensitivity reaction when you see when you see decreased clearance of immune complexes, that is because of type 3 hypersensitivity. So SLE predominantly a type 3 hypersensitivity reaction with decreased clearance of immune complexes. Hematologic manifestations are type 2 hypersensitivity reactions. Next condition is blindness in giant cell temporal arteritis, ophthalmic artery occlusion, ophthalmic artery occlusion. Blindness in giant cell arteritis, which is temporal arteritis because of ophthalmic artery occlusion. Next, what causes myasthenia gravis? Autoantibodies to postsynaptic nicotine acetylcholine receptors. Postsynaptic nicotinic acetylcholine receptors. What causes Lambert-Eaton myasthenia gravis? Lambert-Eaton myasthenia gravis. Autoantibodies to presynaptic calcium channels leads to decreased acetylcholine release. Next is albinism. Albinism is normal melanocyte number but decreased melanin production. Vitiligo is autoimmune destruction of melanocyte. Vitiligo, autoimmune destruction of melanocyte. Autoimmune destruction of melanocyte. What is albinism? Normal melanocyte number but decreased melanin production. Next, what is atopic dermatitis? Atopic dermatitis caused by epidermal barrier dysfunction, genetic factors which are loss of function mutation in filaggrin gene, FLG gene, immune dysregulation, altered skin microbiome, environmental triggers of inflammation can also cause atopic dermatitis. So once more, atopic dermatitis is epidermal barrier dysfunction, genetic factors like it means loss of function mutation in filaggrin gene and immune dysregulation, altered skin microbiome, environmental triggers of inflammation. Next is what causes allergic contact dermatitis. Allergic contact dermatitis is basically type 4 hypersensitivity reaction. During the sensitization phase, allergen activates Th1 cells. This leads to memory CD4 and CD8 plus cell formation. Upon re-exposure, you see CD4 plus cell release cytokines and CD8 plus cells kills the targeted cell. Allergic contact dermatitis is type 4 hypersensitive reaction during the sensitization phase. Allergen activates Th1 cells. This leads to memory CD4 plus and CD8 plus cell formation. Upon re-exposure, you see CD4 plus cells release cytokines and CD8 plus cells kill targeted cells. Next, what is pemphigus vulgaris? Pemphigus vulgaris is type 2 hypersensitivity reaction. IgG autoantibodies form against desmoglein 1 and 3 in desmosomes. This leads to separation of keratinocytes in stratum spinosum from stratum basal, and you see Nikolsky sign positive. So pemphigus vulgaris positive Nikolsky sign, and pemphigus vulgaris is a type 2 hypersensitivity reaction where you see IgG autoantibodies form against desmoglein 1 and 3 in desmosomes, leading to separation of keratinocytes in stratum spinosum from stratum basal. What is bullous pemphigoid? Bullous pemphigoid is type 2 hypersensitivity reaction, IgG autoantibodies against hemidesmosomes, separation of epidermis from dermis, and you do not see Nikolsky sign. So Nikolsky sign is negative. Next condition is spina bifida occulta, meningocele, myelomeningocele, myeloschisis. So there are four conditions: spina bifida occulta, meningocele, myelomeningocele, myeloschisis. These four conditions cause failure of caudal neuropore to fuse by fourth week of development. Failure of caudal neuropore to fuse by week 4 of development. What causes anencephaly? Anencephaly is caused by failure of rostral neuropore to close. However, there is no forebrain and there is open calvarium. What causes holoprosencephaly? Holoprosencephaly is caused by failure of forebrain prosencephalon to divide into two cerebral hemispheres. Failure of the forebrain prosencephalon to divide into two cerebral hemisphere. Developmental field defect typically occurring at weeks 3 to 4 of development associated with SHH mutation. Next, what is lissencephaly? Failure of neuronal migration leading to smooth brain surface lacking sulci and gyri. Lissencephaly, failure of neuronal migration leading to smooth brain surface lacking sulci and gyri. What is Chiari 1 malformation and Chiari 2 malformation? Chiari 1 malformation 1 is when downward displacement of cerebellar tonsils through foramen magnum. Chiari 2 malformation is herniation of cerebellum, including vermis and tonsils and medulla through foramen magnum. So 1 is downward displacement of cerebellar tonsil only through foramen ovale. However, Chiari 2 malformation is when you have herniation of cerebellum, including vermis and tonsils, and medulla through foramen magnum. What is Dandy-Walker malformation? Dandy-Walker malformation is agenesis of cerebellar vermis leading to cystic enlargement of fourth ventricle, which fills the enlarged posterior fossa. Next, what is syringomyelia? Syringomyelia is fluid-filled gliosis-lined cavity within spinal cord. Damages crossing spinothalamic tract fibers. Cape-like loss of pain and temperature. What causes syringomyelia? Syringomyelia is caused by having a fluid-filled gliosis-lined cavity within spinal cord, which damages crossing spinothalamic tract fibers. This leads to cape-like loss of pain and temperature. Next condition, Gerstmann syndrome. Lesion in the dominant parietal cortex leads to agraphia, acalculia, finger agnosia, left-right disorientation. Gerstmann syndrome, lesion in the dominant parietal cortex, agraphia, acalculia, finger agnosia, left-right disorientation. What causes hemispatial neglect syndrome? Lesion in non-dominant parietal cortex causing agnosia of contralateral side. Hemispatial neglect syndrome is lesion in the non-dominant parietal cortex leading to agnosia of contralateral side. What causes Kluver-Bucy syndrome? Bilateral lesion in the amygdala seen in HSV1 encephalitis, which leads to disinhibition and causing including hyperphagia, hypersexuality, hyperorality. Kluver-Bucy syndrome is bilateral lesion in the amygdala seen in HSV encephalitis leading to disinhibition. So because there is disinhibition, there is also hyperphagia, hypersexuality, and hyperorality. What causes Perinaud syndrome? Perinaud syndrome is compression of dorsal midbrain, often due to pineal gland tumors, upward gaze palsy, convergence, retraction nystagmus, light near dissociation. Once more, Perinaud syndrome is compression of dorsal midbrain, often due to pineal gland tumors. This leads to upward gaze palsy and convergence, retraction nystagmus, and also light near dissociation. Next condition is cerebral edema. What causes cerebral edema? Fluid accumulation in the brain parenchyma, increase intracranial pressure, may be cytotoxic or vasogenic. Cerebral edema can be two types, either cytotoxic or vasogenic. Cerebral edema is basically fluid accumulation in the brain parenchyma, leading to increased intracranial pressure. Next condition is aphasia. Aphasia is when you see stroke in dominant, usually left hemisphere, in either the superior temporal gyrus of temporal lobe or inferior frontal gyrus of frontal lobe. Superior temporal gyrus of temporal lobe, which is Wernicke's receptive aphasia, and inferior frontal gyrus of frontal lobe is Broca expressive aphasia. Wernicke, word salad, you have receptive aphasia. Broca is broken words, so expressive aphasia. Next condition is locked in syndrome. Locked in syndrome is stroke of the basilar artery, loss of horizontal but not vertical eye movement. What is lateral pontine syndrome? Lateral pontine syndrome, stroke of the anterior inferior cerebellar artery. Lateral pontine syndrome, lateral pontine syndrome, stroke of the anterior inferior cerebellar artery. Lateral medullary Wallenberg syndrome, stroke of the posterior inferior cerebellar artery. Lateral medullary Wallenberg syndrome, stroke of the posterior inferior cerebellar artery. What is medial medullary syndrome? Medial medullary syndrome is stroke of anterior spinal artery. What is cause of neonatal intraventricular hemorrhage? Reduced glial fiber support and impaired autoregulation of blood pressure in premature infants, leading to bleeding into the ventricles, originating in the germinal matrix, a highly vascularized layer within the subventricular zone. Neonatal intraventricular hemorrhage is reduced glial fiber support and impaired autoregulation of blood pressure in premature infants, leading to bleeding into the ventricles, originating in germinal matrix, a highly vascularized layer within the subventricular zone. What causes epidural hematoma? Epidural hematoma is rupture of middle meningeal artery secondary to skull fracture involving the pterion. What is subdural hematoma? Rupture of bridging veins, acute traumatic high energy impact, sudden deacceleration, injury, and chronic mild trauma, cerebral atrophy because of increased age, chronic alcohol overuse, or shaken baby syndrome. So, main findings in subdural hematoma is rupture of bridging veins, acute because of traumatic high energy impact, sudden deacceleration injury, or chronic. Chronic reasons of subdural hematoma is mild trauma, cerebral atrophy, increased age, chronic alcohol overuse, shaken baby syndrome. What causes subarachnoid hemorrhage? Subarachnoid hemorrhage is caused by trauma, rupture of aneurysm, such as sacral aneurysm or AVM, AV malformation, or leading to bleeding. What causes intraparenchymal hemorrhage? Intraparenchymal hemorrhage is caused by systemic hypertension, most often occurs in putamen of basal ganglia. and thalamus, pons, cerebellum, amyloid angiopathy, AVM, vasculitis, neoplasm, or secondary to reperfusion injury in ischemic stroke leading to bleeding. Intraparenchymal hemorrhage is because of systemic hypertension, most often occurs in putamen of basal ganglia, thalamus, pons, cerebellum, amyloid angiopathy, AVM, vasculitis, neoplasm, or secondary to reperfusion injury in ischemic stroke, leading to bleeding. What causes phantom limb pain? Most commonly following amputation, reorganization of primary somatosensory cortex, leading to sensation of pain in a limb that is no longer present. What causes diffuse axonal injury? Diffuse axonal injury is caused by traumatic shearing of white matter tracts during rapid acceleration or deceleration of the brain. Rapid acceleration or deceleration of the brain, like motor vehicle accident. Multiple punctate hemorrhage involving white matter tracts leading to neurologic injury, often causing coma or persistent vegetative state. What causes conduction aphasia? Conduction aphasia is caused by damage to arcuate fasciculus. Global aphasia, damage to both Broca and Wernicke's area. Heat stroke. Heat stroke is inability of body to dissipate heat, like exertion, leading to CNS dysfunction, example confusion, rhabdomyolysis, acute kidney injury, ARDS, and DIC. What causes migraine? Migraine is irritation of cranial nerve 5, meninges, or blood vessels, release of vasoactive neuropeptides such as substance P, calcitonin, gene-related peptide. Migraine is irritation of cranial nerve 5, meninges, blood vessel, release of vasoactive neuropeptides such as substance P, calcitonin gene-related peptide. What causes Parkinson's disease? Parkinson's disease is loss of dopaminergic neurons of substantia nigra pars compacta. What causes Huntington disease? Huntington disease trinucleotide CAG repeat expansion in Huntington HTT gene on chromosome 4. Toxic gain of function leads to atrophy of caudate and putamen with ex vacuo ventriculomegaly, increased dopamine and decreased GABA, decreased acetylcholine leads to neuronal death via glutamate excitotoxicity and NMDA receptor binding. What causes Alzheimer disease? Widespread cortical atrophy, narrowing of gyri and whiting of sulci, senile plaque in gray matter composed of beta amyloid core, neurofibrillary tangles composed of intracellular hyperphosphorylated tau protein and Hirano bodies. What causes frontotemporal dementia, Pick's disease? Frontotemporal lobe degeneration leads to decreased executive function and behavioral inhibition. So, frontotemporal dementia, you see decreased executive function and behavioral inhibition. What causes vascular dementia? Multiple arterial infarcts or chronic ischemia. Vascular dementia caused by multiple arterial infarcts or chronic ischemia. What causes HIV associated dementia? Secondary to diffuse gray matter or subcortical atrophy in advanced HIV infection. What causes idiopathic intracranial hypertension? Intracranial Increased intracranial pressure associated with dural venous sinus stenosis leads to impaired optic nerve exoplasmic flow, leading to papilledema. Idiopathic intracranial hypertension because of increased intracranial pressure associated with dural venous sinus stenosis, impaired optic nerve exoplasmic flow leading to papillary edema. What causes communicating hydrocephalus? Communicating hydrocephalus is because there is decreased CSF absorption by arachnoid granulations, and you see increased intracranial pressure, papillary edema, herniation. Communicating hydrocephalus, you see decreased CSF absorption by arachnoid granulation, leading to increased intracranial pressure, papillary edema, and herniation. What causes normal pressure hydrocephalus? Idiopathic. Normal pressure hydrocephalus is idiopathic. CSF pressure elevated only episodically. No increased subarachnoid space volume. Expansion of ventricles distort the fibers of the corona radiata. You see wobbly, wacky, wet triad. Non-communicating hydrocephalus is caused by structural blockage of CSF circulation within ventricular system. Example, stenosis of aqueduct or sylvius, colloid cyst blocking foramen of Monro, and tumor. Ex vacuo ventriculomegaly is because there is decreased brain tissue and neuronal atrophy, leading to appearance of increased CSF on imaging. What causes multiple sclerosis? Multiple sclerosis is caused by autoimmune inflammation and demyelination of CNS, specifically brain and spinal cord, leading to axonal damage.